Welcome to Green Sunrise Podcast. Now tonight we're going to be talking about ASIST training. And we may as well just kick off. We'll just kick off and we'll just go for it. We'll see how this looks. Now, we are on air. So tonight is live. And I'll wait for a few people to see if they can kick in from the live event. But we will see how it's going to go. Now, I don't usually do Facebook Lives at all. YouTube Lives. I'm very, very partial for a Facebook Live, but now it's coming into YouTube. I'm trying to get into that realm of Facebook. YouTube, sorry. So, what we're going to talk about is ASIST training. Now, I've done ASIST training last week, and it was a 2-day event, and I'm going to just introduce what ASIST training is, or what ASIST is, for those of you who don't know. Where I am is my house, and I'm looking for a new venue to do lives from or do YouTube videos from. I think where I am at the moment is good enough. I suppose it doesn't really matter where it is, where I'm doing it from, but as long as I'm clear enough in the message that I'm trying to convey, then everything should be good. But the thing is, I've got a bright light. I've got a light. It's giving me this, a headlight, and it probably should be above me, but it's right in front of me. So I do apologise if I'm squinting my eyes a wee tad. But we shall go on. Right, let me see. We need to sort out collaboration. Baron, how you doing, mate? What about mental health during the 7th century? Look, yes, we will definitely speak about that. I've just not time. I must admit, I've just not had time to get back to you, Baron, so I do apologise. I've just been really, really busy, but we have got that in the plans, so please bear with me. Mental health during the 7th century would be good. And I think a lot of people would quite be interested in that. So yeah, we've got that. Definitely got that one. That's planned for this year anyway. Hopefully soon though. I've just been busy making sure that I'm covering all bases. When it comes to mental health, I think you need to be careful. I think I have been very, what's the word for it? Not flamboyant would be the incorrect word, but I've been quite out there, and I've not realising that sometimes the things that you say can have a domino effect, and it can have an effect on people. So I need to be really careful in what I talk about, and also when I'm talking about it, I can back it up with probably great content as much as the information that I've got. So what we're going to talk about tonight is understanding. So tonight's title is Understanding ASIST. What is ASIST? When I was reading ASIST before, I knew it was about suicide, but I didn't know what ASIST was. So I'm going to welcome you to the channel. Thank you very much for coming to the Green Sunrise Podcast tonight, or wherever it is you listen to this podcast or watch it. But what is ASIST? Now, let me explain the acronym surrounding ASIST. ASIST is called Applied Suicide Intervention Skills Training. So, not everybody can do ASIST training. But people who want to do ASIST training, then they probably need to go through certain loopholes, and they need to maybe contact certain people to enable them to do that. I've got my charger here. I don't think my phone needs charged at the moment. I think I can leave that there. So, introducing the topic ASIST, Applied Suicide Intervention Skills Training. Well, I think the introduction speaks for itself. So, The importance of suicide prevention. Now, I must admit, I don't have the stats for suicide. I was going to say fed up reading the stats. I'm not fed up, but I just don't think there's a point in knowing that the stats are there, as in there's so many. For example, in 2015, I read the stat was 75% of all suicides were male, right? Now, but as much as that's a hard thing to take, it's a reality. It's something that's actually happening in this world. Now, the Green Sunrise podcast wasn't just based for suicide prevention, but it's a massive part of the podcast. So when I'm speaking to people, I'm asking about their mental health. And usually, or maybe not so much usually, but suicide, I'm always tapping on that. I'm always making sure that people know that it's there. But also, the reason I'm doing it is because I want people to understand that there is help out there. There is always help out there for people who are struggling with suicidal ideation. And Scott, there's a wee message from Scott McKenna. Yes! When is the turn of the Green Room in Glasgow? It'll be coming soon, Scott. And who is the first guest back? I think I can give you that tonight. The first guest back is Craig Gallagher. If you don't know who Craig Gallagher is, he's a young Scottish actor, and he's Glasgow based, but he's got links to Chester. That's all I can give you. But he's got a massive story, and he's next on the Green Room in Glasgow. He will be the first person. He's the first guest back. The second guest back, I've got that there, but I don't want to say just yet because I don't know if it's confirmed. Well, it was confirmed, but now I just need to work with people. So it's quite hard to work with other people. Not hard to work with other people. It's the wrong way of saying it. But it's hard to make sure that we're all on the same level. So we can say, right, we've got dates ahead, right? So it's quite hard for that. But look, whilst I'm doing that, let's get into the training and the education that I'm entering myself into to enable me to be more, I was going to say not powerful, but to be better, right? Because there's no point in me just talking about my own mental health, right? Everybody's fed up with that. Everybody's done with that, thinking about like that's your mental health. It's your thoughts on mental health. Whether that be good or bad is indifferent, but I think it's best for me to talk about the things that I've learned through the right procedures and the right people, and I'm getting the correct training, I'm getting professional training, and it's best that I just share that knowledge with you. Now, just sharing that knowledge with you doesn't really mean anything, but I think it's all content, isn't it? It's all ideas that we're putting out there, and if I don't see it, then if it's not in the channel, then I can't promote it. So I hope that makes sense. So, what is ASIST? Well, we have got to that applied suicide intervention training, and I'm going to go through. Let me just see how many segments I've got. 1, 2, 3, 4, 5. 5 segments and a conclusion. And then I'll give you an end episode kind of run through. But let's see how long this takes us to get through this. I'm going to hopefully base this in 40 minutes, 50 minutes. I'm planning for 50 minutes. But if we do it longer, if it takes us longer to do that, then so be it. And if it takes us shorter than that, then that'd be great. But let's try and make this. I'm just giving you a quick kind of description of what I've experienced and what I've been doing in the training. I've got a new background, which is Planner 2024, and I've also got my on-air light to make it a wee bit more professional, I suppose. So here we go. I've already explained the word acronym and the acronym of that, but we're going to, in segment 1, I'm going to say what is ASIST. We've already done that. Applied suicide intervention skills training. That's the acronym, but that's beyond that. I'm going to discuss the objectives and the goals of ASIST training, right? So what I'm going to do is I'm going to just take that there. And let's take this. Let's take this. Now I know why the objectives and the goals of ASIST training is to well, the word there, intervention, is to intervene in somebody's thoughts of suicide, right? So somebody makes a decision that they want to make suicide, or they want to go for suicide, then my whole point is the training that I've done, I'm hopefully able to share the knowledge and the education that I've gained from this, and go out there and speak to people and intervene, right? Intervene in that point where they want to commit suicide, and I'm intervening. Let's hopefully change your mind. Let's hopefully change your narrative. Let's change what you're feeling. Let's change what you're thinking. And let's change what you're looking at, right? So that's my end on discussing the objectives and the goals of ASIST training. But whilst we're doing that, I'm going to give you on the background the stuff that I've been studying, right? So let's delve into the objectives and the goals of ASIST training. Number one. Now there's 5 points to it, right? Enhance awareness and understanding, right? One of the primary objectives of ASIST is to increase awareness and understanding of suicide. So participants learn about the signs, the symptoms, and the risk factors associated with suicidal behaviour. By enhancing awareness, individuals are better equipped to recognise when someone may be at risk and intervene effectively, right? So just like I said, it's like intervening and making sure that you can kind of show them a different light. Number two, develop intervention skills. ASIST aims to equip participants with practical intervention skills to respond to individuals at risk of suicide. This includes active listening, empathetic communication, and engaging in collaborative problem solving to develop safety plans. The training provides a structured framework for assembling risk and determining appropriate actions to support someone in crisis. Number three, promote confidence and competence. Another goal of ASIST is to promote confidence and competence in intervening with individuals who may be experiencing suicidal thoughts or behaviours. Through interactive exercises, role plays and feedback sessions, participants have the opportunity to practice applying intervention skills in a supporting learning environment. This builds the confidence in their ability to respond effectively to real-life situations. Number four, facilitate collaboration and connection. ASIST emphasises the importance of collaboration and connection in suicide prevention. Participants learn how to work collaboratively with individuals at risk, as well as relevant support systems such as mental health professionals, crisis hotlines, which I was given at the day. Crisis hotlines and community resources. By facilitating connections and building networks of support, ASIST helps create a safety net for individuals in crisis, right? And lastly, on discussing the objectives and the goals of ASIST training, reduce stigma and increase help-seeking behaviours, right? ASIST training aims to reduce stigma surrounding suicide and mental health issues by fostering an open dialogue and providing accurate information about suicide. Participants are encouraged to challenge misconceptions and promote understanding and acceptance. Additionally, ASIST emphasises the importance of encouraging help-seeking behaviours and connecting individuals with appropriate support services, right? So, the overall, the objectives and goals of ASIST training are focused on empowering individuals to effectively intervene and support those at risk of suicide, right? Ultimately contributing to suicide prevention efforts within communities, right? So that's at the start of segment 1, what is ASIST, explaining the acronym of ASIST, Applied Suicide Intervention Training. Now, discussing the objectives and goals of ASIST training, I've gave you that there. So what we're going to do is we're going to highlight the target audience for ASIST, including educators, healthcare professionals, and community members. So, the audience for ASIST, to me, is, what it is. It's educators, healthcare professionals, and community members. Now, I believe I'm a community member. I'm working towards becoming an educator for ASIST, but it's very early in those days. I don't work for a healthcare professional, so it's going to be harder for the podcast or me at the podcast to get into that community membership, if you like. But whilst I'm doing the ASIST training, and whilst I've done the ASIST training, it's all about me growing my knowledge based on that, and also being able to just to talk about it. It's like, if we don't talk about a situation or talk about our issues in life, I believe that we can't really solve them and we can't really deal with them. So, me becoming a part of this community, the members for the ASIST, is my first step into becoming more vocal and becoming more professional. But I don't think the professionalism really counts. I just think it matters that we're talking about it. And if somebody's out there struggling, that they know that they can actually go to somebody with this. This here is what I'm able to show. And what I'm able to kind of show you, like, I've got a wee bit of experience with the training. Can I help you? Every situation, though, is different. Every situation is a wee bit different. So it's very hard to comment on all that. Before we get to segment 2, I need to also say that the Green Sunrise podcast is also growing arms and legs. And the reason I'm saying that is because there's more co-hosts coming in. They're gladly coming in, which is really good for this vision that I've got for the Green Sunrise podcast. It's not just my vision, though. It's vision that I've stole from people. It's visions that I've read from people. It's words that I've heard, people that I've spoken to, and that's where the co-hosts come in, right? So the co-hosts come into the podcast, or they come into the studio, and I'm asking them, I said, look, would you like to come on and be a guest, first of all? But after becoming a guest, would you like to be a co-host? Would you like to one day be the host? Because this is what it's heading. I'm hoping that the Green Sunrise podcast is going to get spread about, and it's going to be not just me, but other podcasters and other hosts just asking people simple questions about their mental health. Right? I believe that we're not doing that. I believe that we're not doing that. Asking people about the mental health enough. Now, I know the mental health thing is big. It's big for us all. But I still don't believe people are asking simple questions. How are you feeling? How are you? How's your mental health? It's like, it seems to be a tick box. But for me, I don't want a tick box. I just want a general conversation. How are you doing? You know what I'm saying? this general conversation about who you are as a person, and hopefully we can start a conversation. The conversation doesn't need to be on the podcast. That's the thing about this, right? We don't have to have a conversation on a podcast studio environment, but I believe if we can just start a conversation, then maybe the studio might come to you, mate. It might be something you want to do. You might want to tell your story. So that's why Green Sunrise Podcast was born, I suppose. Segment 2. What time's it? 20 minutes in. Segment 2. Why is ASIST important? Right? So what we're going to do is we're going to explore the significance of suicide prevention and intervention. And we're going to discuss the statistics related to suicide rates and the impact on communities. And we're going to explain how ASIST equips individuals with practical skills to intervene and support someone at risk of suicide. Okay? So segment 2 is quite big. So let's go to explore, right? Let's explore the significance of suicide prevention and intervention, right? So I'm going to just write that down there. Explore. I've got a wee pen and paper in there. Now, everybody I believe has got their own view, right? Definitely got their own view on this. But I think it would be good if... Now, I'm working on the laptop, right? And I'm glad what I'm finding on the internet. The internet's quite good if you use the internet properly to find out this kind of stuff. Then it's all right. But you got to remember, not everybody's going to be into this, and I believe that and understand that. So I don't think there's going to be many views on this kind of topic. But let's see. So I think if you can get like 1 or 2 people who watch this because they need it at that point, then, or they just want to know what it is, right? Then that's me. I've done my job. Explore the significance of suicide prevention and intervention. Now, it's suicide prevention and intervention are a profound significance due to the devastating impact that suicide has on individuals, families, communities. Here's an exploration of their significance, right? Saving lives, number 1. Suicide prevention and intervention are essential for saving lives. Every year, millions of people die by suicide worldwide, right? So every year this happens. See, just to say that, millions of people die by suicide. To me, I'm still struggling with that, right? But I suppose that's the reason for this podcast and the reason I'm doing this episode. Now, so the reason every year millions of people die by suicide, making it a leading cause of death globally, right? We're not talking about smoking. We're not talking about alcoholism, even though that's really high. We're talking about suicide. We're talking about people that don't want to be here, right? Now, for me, I can't think of a bigger intervention than that. I can't think of a bigger cause to save life. So, by implementing effective prevention strategies and intervening when individuals are at risk, many lives can be saved, right? Now, number 2, reducing suffering, right? Suicide often results from intense emotional pain, psychological distress, and feelings of hopelessness, right? Or despair, right? See that feeling of hopelessness and despair? It's effective prevention and intervention efforts aim to alleviate suffering by providing support, resources, and interventions, right? I don't know. So that's support, resources, and intervention, right? Let's call it that. And that helps individuals to cope with their difficulties and find alternative solutions to their problems, right? People have got problems. Let's find alternatives. I believe with everything now. I believe if you've got any issues or any problems in life, I believe there's always going to be an answer, right? Now we can't base that on everything, right? But I believe that there can be an answer on that. I believe there's something. It's got to be some way, right? And so let's get to number 3 on the significance about suicide prevention and intervention, right? Protecting mental health and well-being, right? Suicide prevention and intervention are crucial components of promoting mental health and well-being by addressing risk factors such as mental illness, substance abuse, trauma, social isolation. Interventions can help individuals build resilience, enhance coping skills, right? And improve overall psychological health, right? Number 4, preventing long-term consequences. So, the impact of suicide extends beyond the individuals who die by suicide, family members, friends, communities, and now they often experience profound grief, right? Guilt and trauma in the aftermath of suicide loss. Effective prevention and intervention efforts can help prevent these long-term consequences by providing support to those affected and reducing the likelihood of additional suicides within the community, right? So if we can provide that, then this is what this is all about. Number 5, and lastly, there's 2 more. Number 5, there's 7, there's 2 more, there's 5, 6, and 7. Number 5, promoting equity and social justice, right? Suicide disproportionately affects certain populations, including the LGBTQ plus individuals, indigenous communities, veterans, and individuals facing socio-economic disparities. Suicide prevention and intervention efforts play a critical role in promoting equity and social justice by addressing systematic factors such as discrimination, access to mental health care, and social support networks, right? Number 6, economic impact. Suicide has significant economic costs, right? So including healthcare expenses, lost productivity, and impact on families and communities. Prevention and intervention efforts can help mitigate these economic costs by reducing the incidence of suicide and its associated consequences, right? Number 7, fulfilling human rights, right? Suicide prevention is a human rights issue, okay? Every individual has the right to life, dignity, and access to mental health care and support. Suicide prevention and intervention efforts uphold these fundamental rights by providing timely and appropriate interventions to individuals in crisis and promoting a society where mental health is prioritised and supported. In summary, Suicide prevention and interventions are significant because they save lives, reduce suffering, protect mental health and well-being, prevent long-term consequences, promote equity and social justice, mitigate economic costs, and fulfill fundamental human rights. Effective prevention and intervention efforts require a comprehensive, multidisciplinary approach that addresses individuals, interpersonal and societal factors contributing to suicide risk, right? Now we're still in segment 2. We are half an hour into that. I think what we're going to do is we're going to finish segment 2. No, in fact, we'll go for segment 3 as well. Discuss the statistics related to suicide rates and the impact on communities, right? So let's discuss that next, right? Which to me is it's going to be hard because. But it won't be that hard. Actually, it won't be that hard. But let's discuss the suicide rates and their impact on communities. Now that is it's deeply concerning, right? Deeply concerning that people have and by the way, so the impact on communities is deeply concerning and have far-reaching implications. Here's a discussion on statistics related to suicide rates and their impact. Okay. Global suicide rates, according to the World Health Organization, close to 800,000 people die by suicide every year globally, right? Now, that translates to one person in every 40 seconds, right? So figure it right. One person every 40 seconds. So if we are talking about 30 minutes worth of this, we're talking about, let's just think of it. Let's work that out, man. I'm not very good at maths, so let's work it out. So, let's just say 30 minutes, right? So 45 people, right? That's based on 45 people. 45 people have, if you want to be abrupt about this, 45 people in the last half an hour have committed suicide based on these stats, right? Suicide is the leading cause of death worldwide, particularly amongst young people aged between 15 and 29. It's horrendous, man. National suicide rates. Suicide rates vary significantly between countries, right? But many nations are grappling with high rates of suicide. For example, in the United States, the Centers of Disease Control and Prevention, the ODC, reported over 47,500 deaths by suicide in 2019. So we're talking about 5 years ago here. 5 years ago, right? Making it the 10th leading cause of death overall, right? Trends over time. Suicide rates can fluctuate over time due to various factors such as economic conditions, beg pardon, social changes, access to mental health services, and public health interventions. Monitoring trends in suicide rates is essential for identifying areas of concern, evaluating the effectiveness of prevention efforts. Now, number 4, demographic patterns, right? Certain demographic groups are at higher risk of suicide than others. okay? For instance, men are more likely to die by suicide than women, although women are more likely to attempt suicide. Interesting. Additionally, suicide rates tend to be higher among certain age groups, such as older adults and adolescents. So there's a mixture there, man. There's a pure contrast between old people and young people, right? It's like these are the ones. So the ones that are trying to figure life out are also wanting to commit suicide, but the ones that should have figured it out, maybe they feel hopeless. Maybe that's the point of being hopelessness. They're like, I'm done, right? And I'm just throwing it out there. It's a bad thing to throw out, but according to that's what that is for me anyway. I don't know what it is for you. What is that for you? Impact on communities. The impact of suicide extends beyond individuals, victims of their families, friends and communities. Suicide loss can lead to profound guilt, grief, guilt and trauma among those left behind. Communities may also experience social and economic consequences, including decreased productivity, increased healthcare costs, and strained social support networks, right? Number 6, stigma and silence, right? Suicide is often surrounded by stigma and silence, which can contribute to underreporting and inhibit help-seeking behaviours. Addressing stigma and promoting open dialogue about mental health and suicide are critical for reducing barriers to care and increasing access to support services. Now, when I done this, I was given this at the same time, right? And wait till we hear how many people that are there for this, right? So there are so many professional services and voluntary services out there helping not just myself, but the cause or the fight against this suicide thoughts and suicide actions that are actually happening in this world. In summary, statistics on suicide rates highlight, so the stats on suicide rates highlight the magnitude of the problem and underscore the urgent need for effective prevention and intervention strategies, right? Understanding the impact of suicide on communities is essential for developing comprehensive approaches to address the public health crisis and promote mental health and well-being for all, okay? So that's me just, I've just went over discussing the stats. So I'm going to explain how ASIST equips individuals with practical skills to intervene and support someone at the risk of suicide, right? Now, when I done the training, I'm going to be honest, I was excited to do the training for the ASIST, right? But after I'd done it, it fueled my, I don't know if anger's the best word. I don't know if anger's the correct word, but it fueled my fire. Yeah, that's probably the best word. It fueled my fire to keep doing what we're trying to do, but it's not just suicide, but mental health wise. I want to take it on and I want to talk about it, right? And it's not for everybody, but that's what I'm doing. I'm talking about it so that people can watch the channel and they can either relate to it or they can agree with it or they can disagree with it if they want. If they can disagree, it'd be even better if they can disagree, because then I can look at where I've went wrong, right? But let's explain Let's cut that. I'm going to explain the individuals with practical skills to intervene and support someone at risk of suicide, right? So ASIST training is applied suicide intervention skills training, equips individuals and practical skills to intervene and support someone at risk of suicide. Through a structured interactive workshop, here's how ASIST achieves this, right? Recognising signs of suicide risk. ASIST teaches participants how to recognise signs of suicide risk, including verbal and behavioural ones, behavioural cues that may indicate someone is experiencing distress or contemplating suicide, right? Participants learn to identify warning signs such as talking about hopeless, withdrawing, talking about feeling hopeless, withdrawing from others, or giving away possessions, right? Which I've experienced in all sense, right? I've experienced people doing that, giving away possessions, withdrawing from others, and feeling hopeless, right? I've experienced all that. I've experienced speaking to people like that. But then again, that's what I would have done if I was volunteering my time to charities and speaking to people openly. I'm going to experience that. Number 2, engaging with individuals at risk. ASIST emphasises the importance of engaging with individuals at risk of suicide in a supportive and non-judgmental manner. Participants learn how to initiate conversations about suicide, ask direct questions to assess the risk, and express concern and empathy for the person's well-being. So, what they're saying there is, knowing when to ask straight out, are you suicidal? Do you have suicidal ideation? We will talk about later asking if they've made a plan, right? Have you made a plan? Are you suicidal? So, we're going to talk about that. Number 3, exploring reasons for living and dying. ASIST encourages participants to explore the reasons why someone may be considering suicide, as well as many reasons for living, right? Green Sunrise Podcast is one of them, right? Through active listening and empathetic communication, participants help individuals at risk explore their feelings, thoughts, and experiences in a safe and supportive environment, right? Number 4, what I just spoke about there, right? So if somebody's feeling suicidal, then we've got to get them to that point where we're going to talk about what their story is, what they're doing, and we're going to help them try and develop a safety plan with them involved, right? If you're a participant or you're a person who is knowledgeable in what we should do next. So we're going to help people who are suicidal develop a safe plan, right? So ASIST teaches participants how to collaboratively, I'm going to start that again. ASIST teaches participants how to collaboratively, right, develop a safety plan with individuals at the risk of suicide. This plan includes identifying coping strategies, right, sources of support, and step to take if suicidal thoughts or feelings escalate, right? Participants learn how to help individuals create a plan that is realistic, practical, and tailored to their specific needs and circumstances, right? Number 5, connecting with the resources, right? ASIST provides participants with information about available resources and support services for individuals at risk of suicide. This includes crisis hotlines, mental health professionals, support groups, and community organisations. Participants learn how to effectively connect individuals with appropriate resources and follow up to ensure they receive the help they need, right? So if I'm talking to you, if we're talking, right, we're going to go through this. We're going to go through this, double-sided. Man, that's like 1, 2, 3, 4, 5, 6 pages. That's 6 pages, but they're not full. Those pages are not full. There are more than 6 pages. But that's what we do. We take them through that, right? And number 6 and number 7, practicing intervention skills. So ASIST includes interactive exercises, role plays, and simulations to allow participants to practice intervention skills in a safe and supportive environment. Participants receive feedback and guidance from trainers and peers, helping them to build confidence and competence in responding to suicide risk. Number 7, and we will finish that, and once we give your overall, we'll give that. We'll finish on the end of segment 2. There are 5 segments, but we're going to finish in the end of segment 2, right? But number 7, right? Building a support network. ASIST emphasises the importance of building... No, I've just done that, actually. I've just done that. Well, we'll go through it again. Emphasise the importance of building a support network and collaborating with others to prevent suicide. Participants learn how to work together with family members, friends, colleagues, and community members to create a safety net for individuals of the risk of suicide. So overall, ASIST equips individuals with practical skills, knowledge and confidence to intervene and support someone at risk of suicide by empowering participants to recognise warning signs, engage effectively, develop safety plans, and connect with resources. ASIST contributes to suicide prevention efforts and help save lives, right? Let's end today's live on that. It was 48 minutes. Thank you for spending your time on this podcast if you got to the very end, or this episode, should I say. I'm going to be doing more live videos, so let's see if we can do that. This is the first, hopefully, of many from Green Sunrise Podcast. But hopefully the next ones will be with the co-host. So, for example, Bob, Mental Health Bob, he's definitely coming on as a co-host and a host. Brian Mitchell, Behan Mitchell on Twitter. Hopefully, Wee Wido will be on it. Paul John Dykes, Lisa McLean, Wally. I've got a guy called Wally. I'm hoping to go on it. He'll be doing it from Greece. And we've also got many more. I'm hoping Federico will be back in. Hopefully I get Federico back in the studio. But I've got so many more. Wee Maggie, Brother Joe. How can I forget Brother Joe? Brother Joe's massive. One of the guys that just tried to phone me there. Adam Mould. I'm hoping that he's going to be able to give us a hand with this. But we will see. We'll see if this is going to work. But if we don't try, we don't get anywhere. So let's do that. Ian Dyball, Baramu. He's definitely going to be involved. I'm hoping he's going to get back on the phone. And let's do that. I better go. Somebody's trying to phone me. I better go and answer that. It's Green Sunrise work, so I better go and do that. So if you're struggling with anything in your life, please make a comment. Please try and contact me, man. Let's get a conversation. Why not get a conversation? You know that I'm here. If you want to talk, make a comment. We'll contact. I'll tell you how to get a hold of me. You get a hold of me on Facebook, it's Paul C. Quinn. Or on Twitter, Green Sunrise Podcast on Twitter as well. And TikTok, Make a comment. Let's get a private message set up. Let's get speaking to each other. Do not suffer alone. Do not struggle alone. If you've got thoughts and feelings of suicide based on ASIST training, or you want to get involved, you want to just mention something, you just want to talk, let's talk. Have an excellent night, have an excellent day, and let's leave it with what's that little paper? I can't find the bit of paper that was going to talk about it. Never mind. Decide on life. There you go, that's it. We'll end it now. Decide on life. Have an excellent night. Or day, whatever it is you mean this.